Outpatient appointments across the UK account for almost 85% of all hospital-based activity, excluding A&E, and demand for outpatient appointments continues to rise at a rate faster than the growth of the UK population. And it all started with the Patients Association stating that outpatient services currently causes a good deal of inconvenience to patients and sometimes fails to provide care as good as it could be. We would therefore welcome a considered rethink of how they are delivered. The Care Quality Commission's Outpatient Satisfaction Survey and NHS Improvement both say the most commonly reported modifiable reason for DNAs are related to administration or convenience. And the majority of these could be resolved by removing the need for the patient to travel or including the patient in the selection of the time and date for their appointment. So there's a case for transforming outpatient care. There are some administrative factors which include clerical errors or communications failures, such as incorrect communications sent to the patient no longer needing to attend, difficulty for the patient to cancel their appointment, patient unsure who to talk to, whether to leave a message, and not knowing if they've been heard, and poor appointment notification, insufficient time for planning, and some patients have reported receiving a letter after their appointment. And then there's the convenience factors, and these include the distance needed to travel or the cost of travel being prohibitive, currently a real problem. Difficulty getting time off of work or childcare options. Organisation of clinics. Some specialty clinics are infrequent and therefore the choice is limited. And the time of day of appointment may be inconvenient. And finally, transport and parking availability and cost may also be a problem. In 2018, a report by the Royal College of Physicians presented facts about outpatient care within the NHS. A quarter of doctors say that 10 to 20% of their new patients don't need to come into an outpatient clinic at all. Instead, advice and guidance to GPs could be a solution. Nearly 60% of outpatient clinics finish late every week, or at least once a week, and about 30% of doctors say that 2 in 10 of their follow-up patients could have been seen using virtual appointments, therefore reducing the demand for in-person hospital visits. And 1 in 5 potential appointments in England and 1 in 4 appointments in Wales are cancelled or reported as DNA. This equates to 1 day a week of lost time. The majority of cancellations in England are hospital instigated, demonstrating further opportunities for productivity and efficiency gains. 20% of retirees who attended an outpatient appointment reported feeling worse afterwards because of the stress involved in the journey alone. So as a result, the NHS has developed a long-term plan, and at BHT, our outpatient transformation plan is aligned with this, which is to achieve the following by March 2023. Number 1, 25% reduction in hospital follow-ups. 2, 5% of patients on a patient-initiated follow-up pathway, or PIFU. 16 of every 100 GP referrals to be provided with advice and guidance, and 30% of follow-ups need to be virtual. And this can be summed up by the NHS's long-term ambition, which is to avoid unnecessary face-to-face outpatient attendance, which became an urgent imperative as a response to COVID-19, and now this will help restore services. So as a trust, we'll do this by offering video and telephone consultations, empowering patients to book their own follow-up care through PIFU, helping clinicians avoid the need to refer some patients to hospital appointments when their needs could be met elsewhere, and streamlining booking pathways using full partial booking. So as we continue to roll out through all of our specialties, improve usage and access to the digital patient portal, virtual consultations, patient-initiated follow-up, partial booking, a 25% reduction of follow-up appointments, and a 5% of PIFU pathway. On the horizon, to help support these activities, are other initiatives that will create a robust and effective solution. 1. Digital Hub, a designated area which clinicians can use to carry out virtual appointments, which means we can utilise clinic space for much needed face-to-face appointments. Number 2. Robotic Process Automation, or RPA, known as virtual assistants, which will remove repetitive manual processes to streamline the facility to book appointments and eliminate errors and reduce admin time. 3. Improved room allocation system, which will provide effective monitoring and oversight. And 4. Increasing links to voluntary sector to help patients live well while waiting for treatment. Ultimately, all this activity is for the benefit of our patients and staff by providing improved access using all types of media, better communications, and improved work processes.